Hi everyone, I hope you're having a great conference so far. My name's Richard Moore. I'm a Senior Research Fellow at Sheffield Hallam University, and I'm here to talk to you about a chatbot we've been developing for the past couple of years to support inactive adolescents to overcome barriers to participation in sport and physical activity. And basically what that means is we're looking to help young people, to give them the tools and support to enable them to be more physically active in future and lead healthier lives. Before we start talking about that, I just wanted to give you a bit of background about my journey into conversational AI. So I've been a researcher for around 15 years, and I've led national research projects on behalf of the Department of Health, Premier League Charitable Fund, Rugby Football Union. We've done lots of work with young people in schools, particularly around sport and physical activity. One of the things I've noticed is that a lot of the projects don't work as well as they could do. And the Lancet, which is a leading health journal, has actually recently reported that many of the interventions in school have not been successful in supporting young people to be more physically active. So I saw conversational AI as a really great opportunity to try and support young people, educate them, using the tools they already use, using social media, and applying some of the learning from the other research that we've taken part in. But also I've been working on wider projects as well over the last couple of years. So for the National Health Institute for Health Research, I've been working on type 1 diabetes chatbot to give people evidence-based information about their condition, and also guided family therapy support for a genetic condition as well. We're currently co-designing and prototyping that at the moment. But in terms of the physical activity chatbot, what's the main problem? Why do we need to do something like this? Well, there's been no improvement in global levels of physical activity since 2001. We can argue that the problem's potentially getting worse. Pandemics possibly exacerbated some of those issues. And more than a quarter of the world's adult population were physically inactive in 2016. In terms of adolescents, there's around 80% who are insufficiently active, and this puts them at risk of lots of diseases, cardiovascular disease, diabetes, just to name two, but there are lots of other potential diseases that they could be putting themselves at risk because they're not physically active. And a lot of obviously are obese and overweight now, so we need to do something to really support this population. There's a huge cost to health, but there's also a cost to the public. If we just look at the US and UK alone, and these are probably underestimates as well, looking around 54 billion, which are direct healthcare costs, and 31 billion of that is paid by public sector, which means a huge amount of the public purse from our taxes, which are going into these areas, are going into support conditions where if we become more physically active, we could potentially prevent some of these costs to our health and the public purse. And it's the same in the UK. 7.4 billion is an estimate by the Everybody Active Everyday governmental report. So it's really clear we need to do something about this. And we've just done some research, a survey of over 200,000 secondary school children, and we found that there were about 52 barriers, and around half of these young people had low confidence and self-esteem. But there was a range of many other barriers as well. And these are just a couple to talk about. So lack of time, lack of local provision, meaning they don't have the opportunities, the facilities, the environment maybe to go and do physical activity. So for instance, they might not think it's very safe where they are. They might not feel confident going out. They might not have any friends. They might be bullied. All these different issues that young people are facing at the moment. And also we found that particularly in schools with parents that we're distracted. We're very busy, we're distracted by technology, through work, through other activities, other interests. So we tend to have lost the kind of lost art of conversation that we might have, that young people may have with teachers or parents or friends in some cases. And often that means that we're not identifying some of the solutions or some of the issues that young people face and trying to support them to overcome these. So from our research, we've realized that there's a number of different things that we need to provide for young people. We need it to be personalized. So we need whatever support we're going to give young people to be more physically active. It needs to be personalized for them and work for them. But it also needs to be low cost, because there's lots of young people who are inactive in deprived neighborhoods. And therefore it needs to be very low cost, ideally free for young people to use. They also need to be able to access it 24/7. So whenever they need to. So if that might be before a physical activity session, it might be at home when they're on their own in the bedroom, when they have time to reflect, or it could be out on the road, could be in the middle of physical activity, for instance. So you need to be able to access support anytime. The support we provide needs to be evidence-based, and there's lots of fantastic research out there that can be applied within conversational devices. It also needs to be multi-component, because like we mentioned, it needs to be personalized. There are many different barriers that young people face. So a single intervention which tackles a single barrier is not going to work. It has to be able to be adaptable to work across lots of different barriers to support young people. It needs to be accessible. So what do young people have to be able to access that support? Most young people in secondary school now have a mobile phone or access to a computer. It also needs to be inclusive. Okay, so it needs to be designed to encompass different types of cultures and different young people of different ages within that secondary school grouping. So we feel that personalized conversational AI is the way to go with this. We can't see any other way of being able to get directly to young people, try and support them directly, educate them, and giving them the tools they need to overcome any barriers to physical activity. So this is the solution, a chatbot designed to support lots of different barriers. It's multi-component intervention with lots of solutions built in, depending on the particular barriers that the young people face. We provide them with conversational support and guidance, which might be psychological, for instance. So it might be psychological support, low-level psychological support aligned to their motivations. Once we've identified those barriers, it might be practical solutions aligned to the motivations. So it might be just ways supporting them of how they can be active within their home, outside of their home. It might be ways of trying to identify other options within their communities, community groups, sport and physical activity sessions. There's lots of different support we can provide. We might also signpost them to other relevant opportunities. So what we found from looking at those barriers, lots of young people are suffering from mental health problems. So there might be certain things we can support with through the bot, but there might be more serious mental health problems that we might be able to signpost young people to other apps, other support, other medical support they may be able to identify within their communities. So just a little bit more about the target audience. Why are we targeting secondary school children? Well, the main reason is because there's a triple benefit to this. So if we can support young people today, then we can hopefully enable them to be more physically active in future, but also into adulthood. So preventing lots of those potential health risks that we talked about earlier. But also the next generation, these young people will go on to have children, and hopefully if they've got the knowledge and skills, they can then pass this on to the next generation, who will hopefully live more active and healthier lives. And this is supported by the World Health Organization, who have written a study on this in terms of how we can support young people to be more active and yield that triple benefit. So I'm just going to talk about two elements of the methodology that we've worked on. I haven't got time to go into a lot of detail, but these are just two of the main elements, really. So one crucial element of this chatbot is that we're co-designing it with 10 adolescents who are based in the school, and they actually apply to become part of this process. So the applications were absolutely fantastic. They were children who fit the bill for this particular project, really struggling in terms of confidence, self-esteem, and really open for us to try and help them with this chatbot. So one, they're keen to help develop the chatbot and support us to ensure that it is fit for purpose, but also they want to help other young people because they know that lots of other young people are struggling with similar challenges in schools. So they want to have a part in trying to develop a chatbot which helps them. And I can tell you as well that young people are ready for this. You know, they're sick of going on the internet, trying to find solutions, trying to find information. It's often pointing them in the wrong directions. They're not able to find the information they want quickly enough. So chatbots are a perfect way of providing that information and support, which is personalized to them. So what we've done is sent out some booklets. We've interviewed them. We've sent out booklets to gain their perspective on how the chatbot should be designed. So in terms of the information, so there's an example there at the bottom of the page about what types of other content they would like to be seen added to the chatbot. What persona should the chatbot have? What should it be called as well? So we mentioned that it's called, you might have seen on the title slide, it was called Phyllis, but chances are this might change depending on what the young people would like to see it called. So there's lots of different elements of the co-design, and they've also helped us to identify the kind of primary or key barriers that we want to try and support initially through the prototype. And the other innovative method that we're using to design the chatbot is using the COM-B model of behavior change, which is a model used within health to design interventions. And the reason we're using it is because it allows us to identify those sources of behavior, particularly around the barriers that we've talked about. And it allows us to categorize those barriers and develop suitable interventions or suitable conversational content which will support young people. So here's an example of the target behavior that we're aiming to support. So I'll just take you a step back there. So in terms of the behaviors, there's a capability. So young people need to be having the capability of being physically active. But if we look at the opportunity on the right-hand side of the green wheel, we need to create that opportunity for young people to be physically active every day and for enable them to feel comfortable in seeking that opportunity as well. And you can see at the bottom of the green wheel there is motivation. So we want to help young people to feel motivated to be physically active, to want to actually go out there and do more physical activity. But the aim of this is to lead to a main target behavior, which is to participate in at least 60 minutes of moderate intensity physical activity a day across the week, which is the minimum government guidelines which is set for this age group. So another reason we use the COM-B, as I mentioned before, is so we can categorize those barriers. So for instance, some of the barriers might be around physical capability. So there might be, young people might just not have the physical skill, strength, or stamina to be physically capable. And this is kind of the area where a lot of the existing conversational AI tools and apps are directed at, mainly at getting stronger, getting fitter. But what we're also looking at is lots of different elements to this. So in terms of psychological capability as well. So the knowledge or psychological skills to engage in physical activity, like I mentioned, low self-esteem, low confidence. We want to try and help young people to overcome those barriers to become physically active. And what the COM-B model also helps us to do is understand that in order for young people to change their behavior, we need to be looking at capability, opportunity, and motivation together. And that's why it's important that we provide something which is multi-component, which is dealing with all these different barriers, but providing them with the solutions to overcome them. So whether that be capability, whether that be looking at the social opportunity, whether young people being bullied, for instance, whether we look at the motivation, you know, what's the reasons why they want to become more physically active? Is it for their appearance? Is it to lose weight? Is it to feel fitter? So if we understand that, we think that we can build a model, which we've already started to do, to support young people to get the education to overcome these barriers. So in terms of delivering the chatbot to young people, there's two key methods. Again, quite a novel approach. So the first one is guided family support. So actually using the chatbot to work with the young person, the families together, so it will guide them through identifying those barriers and then providing them with solutions. So working together, hopefully also educating the parents to be able to support their young children or guardians as well to overcome those barriers. But also, we understand that young people might not necessarily want to speak to other people, and that's one of the key reasons why chatbots have been deployed successfully in other apps, because young people don't want to feel like they're being judged. They might not want other people to know that they're having problems. They've got challenges, particularly around mental health. So we want to try and provide them with that support directly, where they can access it from the comfort of their home or wherever they might need to. And we'll do that because we can access various channels and we can deploy the chatbot through channels that young people are already using. And at the moment, we're developing a chatbot, but in terms of the future, this could become a skill, voice assistant. It might also be used in a robot. So we're working on another project at the moment, which is a robot as schoolmate. So the conversational design that we put together through this project could be applied through a robot in future, and also in the metaverse as a potential avatar. So I just want to just highlight the project team. So there's myself, Lizzie Freeman from the university, and also advisors as well, Alessandro De Novo and Alison Metcalf, who are a major part of the team. And our partners as well, Bot Society in terms of the conversation design, and My Behind in terms of the chatbot development. And that's all. So thank you very much for listening. If you want to get in contact with me, then please do via email, and you can also follow my LinkedIn for updates as well that we'll be providing over the next few months. Enjoy the rest of your conference. Thanks for listening.